When compared to injuries across the occupational spectrum, hand cuts and lacerations aren't typically the most debilitating, but they are some of the most difficult to heal well. Due to the dynamic and multi-directional movement of the hand, a wound anywhere in the area from the wrist to the fingertips is just a lot more likely to reopen. A recent U.S. Department of Labor study found that of all injuries reported, injuries to the fingers and hands accounted for more than 23% of total workplace injuries in the United States. So let's take that 23% of all injuries and see what we can do to drastically decrease that number. According to OSHA, 70% of all hand injuries could have been prevented by wearing gloves. Now, we all know that according to the hierarchy of controls, PPE is the last line of defense and the least effective means of controlling hazards. However, this one item of PPE is so heavily relied on, it could prevent more than 70% of hand and arm injuries. Beyond that 70% of employees who weren't wearing gloves, the remaining 30% that were wearing gloves that were inadequate, damaged, or the wrong type for the hazards that were present. This sometimes causes difficulty with gloves because the right glove for the job may change depending on the task. Okay, now let's talk about the elephant in the room. What about the object that actually did the cutting? Obviously, this is a significant factor in this equation. Hand tools are the culprit in 55.86% of lacerations, while machinery is involved in 26.74%. Studies that have looked at hand cuts and lacerations have cited numerous tools, machines, equipment, and materials that are present in the workforce that are part of the problem. Consider the amount of force needed to use a cutting tool. Often, dull knives are more dangerous than sharp ones. The reason? Force will be applied when the blade fails to cut, resulting in deeper cuts and lacerations if the hand slips or the blade binds in the cutting media unexpectedly. It may be counterintuitive, but it's safer to keep cutting tools sharp. Whenever possible, utilize safe cutting tool options. Those without an exposed blade can help engineer out the cutting problem. Make sure guards for cutting tools are always in use without exception. One of the most surprising things about these injuries is that they're actually more likely to impact young workers who are under the age of 25. Although this group statistically reports fewer injuries overall when compared to more experienced coworkers, young workers report the highest percentage of cuts and lacerations to the hand, with those from 16 to 19 reporting 16.12% of all hand cuts and lacerations. But the next largest group are those from ages 20 to 24, who report 13.8% of these injuries. Those numbers steadily declined to workers from 65 and older, reporting just 5.46% of cuts and lacerations to the hands. An important fact to note with this is that, regardless of age, those employees who have been on the job for 3 months or less are the most likely to have a hand cut or laceration injury. The fifth contributing factor involves a study that was done by the Liberty Mutual Institute for Safety in collaboration with the Harvard School of Public Health. They found that the risk of hand injury was significantly elevated when tools, equipment, or work pieces did not perform as expected, or when workers were performing an unusual task and were distracted or rushed. So there you have it. Those are the 5 biggest causes of hand cuts and lacerations in the workplace. I hope you found this information useful. Knowing the main causes of hand cuts and lacerations in the United States can help us apply the most effective measures to make sure that this injury decreases nationwide, starting with our own workplaces.